Hello Health Source Nation, this is Dr. Tim Christopherson coming to you from Health Source of Chattanooga, your gold standard of chiropractic care in the Chattanooga area. If you or someone you love is actually looking for a chiropractor, visit our website listed below and feel free to take advantage of that new patient special. Today what we're going to tackle in our spinal tip is actually we're going to talk about the mid-back area and what tends to happen into the upper shoulders and things of that nature. Like I mentioned in previous videos before, we talked about one of the biggest issues in biomechanical syndromes we're seeing is actually what they call the forward head posture, which means that the head draws forward over time. And when that happens, gravity will slowly start to act on the spine and it will start to cause dis-ease or it will start to cause problems. So what we're going to look at today is some of these problems that could be caused because the head has been moving forward for so long, and it will start to put pressure on the muscles, number one, which leads to neck pain and upper mid-back pain. But secondly, and more importantly, how this is actually going to cause problems onto the spinal nerves and the nerves that go into vital organs, including the heart, but also even to the stomach and upper GI issues. So if we look at these, my favorite charts that I've referenced several videos, this is the damaging effects of what we consider misalignments in the spine, and we'll see the areas that are affected. And if we actually look, this green area here is representing the thoracic or the mid-back area. And actually I'm going to focus in on this area right in here, which is the T4 through the T9 area, which will go and affect a lot of the issues into the stomach, the gallbladder, the liver, and things of that nature. And why am I focusing on that as opposed to talking about upper back pain? Well, because there's actually some research done in 1958 from the Journal of American Medical Association that says that there's a misalignment in these areas between T6 and T9. That actually played a huge role in patients, in 90% of the patients, who had peptic ulcers. Now, I'm not saying that chiropractic is here to cure ulcers. I'm not saying that. What I'm trying to say is the bigger picture, meaning that the nervous system controls everything. And if that is not functioning 100%, we're more susceptible to sickness or we're not going to be as healthy. So even when we see the research done in 1958, it's really an eye-opener to think that they've actually identified back at that time that these issues, a misalignment onto the spinal nerve, could lead to some of these other bigger symptoms and disease. So as you go through your work week, I understand that you're going to be having a lot of neck and upper back issues, but let's think a little deeper this week and think about what it's actually doing to the heart, to the stomach, to the gallbladder, and see, and start to think about how big of an issue this could be. So again, if you or a loved one is looking for a chiropractor and looking for the gold standard of chiropractic in Chattanooga, feel free to forward on this video or visit our website listed below, and we look forward to providing an unbelievable experience. Thanks for visiting Dr. Christopherson on the Health Source Spinal Tip of the Week.